Hello everyone. Today is a demonstration on how to apply your personal protective equipment or PPE. What we have here is a gown, a mask, and your safety goggles. If you wear prescription glasses, we do have side shields that are provided in dispensary for you to wear during any procedure. Regarding gowns, if you are an assistant doctor, you will wear the green gown. If you are the providing student doctor, you will wear the blue gown. The first thing you'll want to do is wash your hands before donning any PPE. And you'll want to vigorously scrub your hands with the soap. You need to remember that it's not just the soap that removes the germs from your hands, it's the actual friction of rubbing and trying to remove any oily or debris substance you have in your hand. You do want to scrub your hands for at least 20 to 30 seconds, and that will ensure that you have clean hands before donning your gloves. Okay, so the first thing that we'll put on is our gown. The next item we'll place is our mask. Third item will be our safety glasses. And the final item will be our gloves. Make sure that your gloves fit over the cuff of your gown to prevent any splatter into your skin. That's it. That's how you apply your PPE. Hi, this video is to show you the items that you will need in order to set up your operatory for patient care. What you will need is a piece of butcher paper for your mobile cabinet. You will need a headrest, saliva ejector, high vac suction, 2 air and water tips, and 4 sleeves for each of these. You have a bracket paper cover. You'll need barrier tape and a quick cap, patient bib and bib clip, and this will begin the process for your setup. We're about to begin placing barriers all over your handles. You will first place your quick cap over your tray and then your bracket table cover over that, air and water syringe, and your sleeve. You do not need to wear gloves to dress your room. However, you do need to have clean hands. This item that we're placing the barrier tape is here because you're able to operate the chair from the side as well. Place your high vac suction, saliva ejector, air and water tip, and your sleeves for each of these items. The last thing you'll apply is your headrest. This is applying the barrier tape to your overhead light. This is the way you would set up your mobile cabinet. You want to preserve this bag because this is the bag that you will use to return your instruments. So basically, you want to open it by pulling back and away. At this point, you don't need gloves to take the instruments out of the bag. You will set it down. And remember to save your bag because this is how you'll return your instruments. Okay, one of the things that you need to remember is that anytime you begin a procedure, you do need to flush your lines 20 seconds. Take it and, okay, and then you'll also want to flush your air and water syringe, 20 seconds. So what we're doing is putting our cassette back together to be able to transport our instruments back to central sterilization. We do need to make sure there's no cement left on the instruments. If there is, we'll need to remove any cement off of any instruments that are not sharp. One thing we need to remember to do is to spray our instruments before we return them to get most of the soil softened up before they go into the ultrasonic. Once you're sure that there's no cement on the instruments, you're able to close your cassette. And remember that pouch that we asked you to keep. This is what you'll use to transport the instruments back to central, just like this. The next thing we'll show you is how to break down or undress your operatory. One of the things that helped me is by taking the headrest from the chair, turning it inside out, and then begin by removing all the disposables from the unit. Okay, so the next thing we're going to do is flush our lines, and you'll want to do this anytime there's a lot of blood involved in your procedure. You'll find these under the sinks in whatever group you're in, and there should be these little enzyme packets that you'll also use to add to the water that you'll be flushing the lines with. Just take this to the sink, and you'll want to set this on the floor because it will tip over and it can spill. Set it down on the floor, take all your suction. So we're ready to attach our line lines to our cleaning solution. Sometimes you'll find that there's dried blood inside the actual suction tip here. So by opening and closing the suction will help break down any dried blood that's around the tip. And so you'll use the entire solution for the cleaning of the lines. The last thing we'll need to do is cavicide all of our surfaces. Anywhere you think there was splatter, you'll want to wipe. You'll want to pick up your hoses and wipe those down. Also, cleaning the syringe goes into making sure that there's no blood left inside, and if there is, a cavicide will go in there nicely and clean up any leftover dried blood. Repeat this until all your hoses are nicely white. You also want to make sure you wipe down your counter spaces, any mobile carts you've used, and that should conclude your cavi wiping of your chair. So now it's time to remove our PPE. The first thing you want to remove is your gloves. You pinch it, you turn it inside out, you grab right hand, and then you go under the glove, pull it, and then you can dispose of your gloves. Next item is your goggles, your gown, and you want to peel it away from you. And the last thing to come off is your mask.